Now, Mr. Speaker, with permission, I'd like to turn to our path out of this pandemic. All the way through our fight against the virus, we've looked forward to the day when we can roll back legal restrictions and get closer to normal life. Now, thanks to the shared sacrifices of the British people and the protective wall of our vaccination programme, we have made huge advances. Today, I'd like to update the House on the next decision that is in front of us, whether to proceed to step 4 of our roadmap next Monday. Now, as I set out to this House last week, this will be a major milestone for this country, taking us another step closer to the life that we all used to live. It means carefully removing more of the restrictions that have governed our daily lives, like how many people you can meet, how many people can attend weddings, and how many visitors you can see in care homes and bring them together with their loved ones. We've all been yearning to get there, and we all want this to be a one-way journey. So we've acted in a measured way, taking one step at a time and looking at the very latest data and at our 4 tests before deciding whether to proceed. Mr. Speaker, the first test is the success of our vaccination programme. Ever since the 8th of December last year, when the world's first clinically authorised vaccine was given right here in the UK, we've been putting jabs in the arms of people at a phenomenal pace, giving over 80 million doses in just 7 months. We've given more doses per capita than any other large nation. And as a result, around 9 in 10 adults in the UK now have COVID-19 antibodies, which are so important in helping us and our bodies to fight this virus. To bolster this protective wall even further, we made the tough but necessary decision to take a 4-week pause to step 4, so we could protect even more people before easing restrictions. And since making the decision, we've been able to give 7 million extra doses across the UK. We've pledged that by the 19th of July, that we would have offered every adult a first dose of the vaccine and have given 2 doses to 2/3 of all adults. And I'm pleased to inform the House today that we're on track to beat both of these targets. So, as we make this crucial decision, we're in a stronger position than ever before. Mr. Speaker, we've looked not just at how many jabs we've put in arms, but what impact they're having on hospitalisations and the loss of loved ones. And this is our second test. There's increasing evidence that the vaccine has severely weakened this link, the link that was once a grim inevitability. Data from Public Health England estimates that 2 doses of a COVID-19 vaccine offers protection of around 96% against hospitalisation, meaning fewer COVID patients in hospital beds and fewer mourning the loss of a loved one. And they also estimate that the vaccination programme in England has prevented between 7.5 million and 8.9 million infections. It's prevented some 46,000 hospitalisations and around 30,000 people losing their lives, all because of the protection the vaccines can bring. Mr. Speaker, our third test is around whether infection rates would put unsustainable pressure on the NHS. And I want to be open about what the data is telling us and why we've reached the decision that we have. Cases are rising, propelled by the new, more transmissible Delta variant. The average number of daily cases is over 26,000, and this has doubled over the past 11 days. And sadly, the case numbers will get a lot worse before they get better. We could reach 100,000 cases a day later in the summer. Hospitalisations are also rising, with sustained growth over the past month, and once again, they will rise too. But we should be encouraged that hospitalisations are far lower than they were at this point during the previous wave, just as we should be encouraged that people over the age of 65, who are more likely to have had both doses of the vaccines, They make up 31% of COVID admissions last week, compared to 61% in January. This is further evidence that our vaccination programme is doing its job and protecting the NHS. And as more people get the jab, our protective wall is getting stronger still. We will stay vigilant and keep a very close eye on the data, as well as the impact of long COVID, where we're investing £50 million into new research. But on the basis of the evidence in front of us, we do not believe that infection rates will be put unsustainable pressure on the NHS. It's so important that everyone still does their bit in helping the NHS to stand strong, and the best thing that each and every one of us can do, if we haven't done already, is get the jab and, crucially, get both doses. Now, our final test is that the risks are not fundamentally changed by new variants of concern. We've seen from the growth of the Delta variant, which now makes up 99% of new cases in this country, just how quickly a new variant can take hold. However, although the Delta variant is more transmissible than the Alpha variant, the evidence showing 2 doses of the vaccine appears to be just as effective against hospitalisation. But we know that the greatest risk to the progress we've made is the possibility of another new variant, especially one that can escape immunity and puncture the protective wall of our vaccination programme. So even as we look to ease restrictions, we'll maintain our tough measures at the borders, and we will expand our capacity for genomic sequencing against, already it's one of the largest in the world, so that we can come down hard the moment we detect a new variant. Now, Mr. Speaker, we have looked closely at the data against these 4 tests, and we firmly believe that this is the right time to get our nation closer to normal life. So we will move to the next stage of our roadmap on July the 19th. Now, to those who say, why take this step now? I say, if not now, when? There will never be a perfect time to take this step, because we simply cannot eradicate this virus. Whether we like it or not, coronavirus is not going away. But moving forward next week, supported by the arrival of summer and the school holidays, it gives us the best possible chance of a return to normal life. If we wait longer, then we risk pushing the virus towards winter, when the virus will have an advantage, or worse still, we will not be opening up at all. We delayed step 4 by 4 weeks so we could build our vaccine wall even higher. And we believe this wall means that we can withstand a summer wave. And while the wall would be higher still if we waited till winter, we know the wave would be much more dangerous. So while we know there are risks with any decision, this is the most responsible decision that we can take. This step forward is about balancing the harms that are caused by COVID with the undeniable harms that restrictions bring. These restrictions, they were vital to protect the NHS. But we must be upfront about the impact of keeping them, just as we are about removing them. The rise in domestic violence, the impact on mental health, the undiagnosed cancer, to name just a few. So we'll ease the restrictions next week, while at the same time we'll be maintaining the defences we've built against this virus, like our vaccination programme, where we still need more young people to come forward, our work to support the most vulnerable, and the contingency plans that we've put in place to stay one step ahead of this virus. But this is not the end of the road. It's the start of a new phase of continued caution while we live with this virus and we manage the risks. And we're publishing a plan today showing the safe and gradual approach that we'll be taking throughout the summer. It includes details of how we'll be encouraging businesses and large events to use certification in high-risk settings to limit the risk of spreading the infection, how we'll use guidance for those who are clinically extremely vulnerable, and details of a review that we'll be conducting in September to assess our preparedness for autumn and winter. Mr. Speaker, as we make these changes, it's so important that people act with caution and with personal responsibility. For example, everyone should return to work gradually if they're currently working from home. They should try to meet people outside where that's possible. And it's expected and recommended that people should wear face coverings unless they're exempt in crowded indoor settings like public transport. Mr. Speaker, I also want to take this opportunity to update the House on our policies for self-isolation. Last week, I announced to the House that from the 16th of August, double-jabbed adults and under 18s will no longer need to self-isolate if they're a close contact of someone with COVID-19. Until then, with case rates are expected to rise, it's vital that we make sure our systems for self-isolation are proportionate and that they reflect both the protection given by our vaccine programme. Now, as part of this approach, we'll be working with clinicians and the NHS to explore what more can be done for colleagues in patient-facing roles. This would only be used in exceptional circumstances where the self-isolation of fully vaccinated close contacts could directly impact the safety of patients, so that we can keep our vital services going as we safely and gradually get to a closer to normal life. Mr. Speaker, the 19th of July will mark another step forward in our road to recovery. Getting here has been hard fought and it's been long awaited, but this battle isn't over yet. Let's move forward in a confident but measured way so that we can get closer to normal life and protect the progress that we've already made. I commend this statement to the House.